Hi, I'm Adam Rosen. Thanks again for tuning in. So I'm recording this in May, and May is Mental Health Awareness Month. So for that reason, I thought I would do a video talking about post-operative depression. And statistics show that 8% of United States adults are diagnosed each year with depression. So there's a large number of us that are struggling with depression, and I was one of them. I myself still struggle with depression from time to time. So this video is deeply personal for me. I want to share with you what are some of the signs and symptoms that you might see if you're dealing with postoperative depression, why postoperative depression might occur, and things that you can do to help improve your symptoms. So sit back and stay tuned. Okay, so thanks a lot for tuning in again. If you haven't already, please like and subscribe so you get updates when videos like this come out. And if you're looking towards knee replacement in the near future, please be sure to check out my book, The Knee Book, which you can find on Amazon and other platforms. And you might be thinking, depression, why is another doctor talking to me about depression? You know, again, there's 21 million American adults each year that are diagnosed with depression, and I was one of them. In 2023, I was dealing with issues at home. I had some oral surgery and had a complication, but the main issue and the main problem resulting in all of the burnout and moral injury crisis that you're seeing in healthcare workers is at work. So we have the electronic medical record, which places a huge burden on us. There's an administrative burden, and there's more administrators now in most places than doctors. We have insurance issues, constant denials and delays of care when we want to do things for our patient. We've had staffing shortages in both the operating room and the office, and supply chain issues, and more demanding patients. And that's just to name a few. And all of these things culminated in an overwhelming sense of pressure on my shoulders, a sense of fear, a fear of making a mistake. And I went into what is termed a major depressive disorder. I came home one day and didn't get out of bed for about 3 weeks. I didn't eat, I didn't shower, and I needed professional help. And I got professional help. I found a therapist and a psychiatrist, and I got into a cognitive behavioral program, all of which have helped me immensely. And you may be wondering, why am I being so open? One of the things that I realized in my recovery is that I wanted to be open about my struggles with mental health. I mean, if a doctor can't talk about it, how should we expect you to talk about it or even seek help if you need it? And what I found has been completely positive. Patients that I've known for years that have asked where I was when I took time off of work, and I've told them, have been 100% supportive. People and friends that I know that I've talked to, a large number of them have told me that in their life, they went through a similar episode in their life. And what is more important to me is that a lot of doctors that I've talked to, now that I've been back, have opened up to me about their own personal struggles. They're dealing with the things that I was dealing with prior to my downfall. But I am here to tell you that you can get better. I did. It took time, and I'm not perfect. Nobody is. So there are days where I struggle, but I go back to the things that I learned that really helped me. And that's what I want to share with you are a lot of the things that helped me are things that you can do on your own. And that's what we're going to cover today in this video. So sit back and I'm going to go over some of these topics. So you might be feeling down, and all of us feel down or sometimes feel depressed. It doesn't always mean that we have clinical depression. But if you see some of these signs and symptoms, it might clue you in to the fact that you might be suffering from postoperative depression. So things like sleeping disruption, either insomnia or sleeping too much, a change in appetite, usually a decrease in appetite. The sense of fear and anxiety can be common in people that are depressed. A lot of people will find that they're more irritable. They tend to isolate. A lot of people will feel as if they're a failure. And there's also a thinking that life is hopeless. These are what we call distorted thoughts. So if you're having some of these or similar types of feelings or thoughts, it is possible that you might be dealing with postoperative depression. Now, I'm not a psychiatrist. So again, this is why I want to be open about this. So if you're seeing these things in yourself, that it maybe opens the door to ask for help. And the first thing you can do is start with your primary care physician, and they can then refer you to a specialist to determine whether or not you're actually dealing with depression. So you might be wondering, yeah, like, so why does depression really matter? I'm having my knee replaced or my hip replaced. And it does matter because studies have looked at this and they found that patients that have preoperative mental health issues like depression and anxiety have longer hospital stays. And they're more likely to be discharged to a skilled nursing facility as opposed to home. Patients that deal with preoperative depression and anxiety are also more likely to be readmitted to a hospital after they've been discharged home. But what's worse is that a lot of patients actually have lower scores when we look at pain and satisfaction and function after their knee replacement is completed. Now, the good news is that studies have also shown that depression and anxiety can improve after surgery. Sometimes one of the causes may have been chronic pain or you not having the ability to do things in your life that you really wanted to do that used to bring you joy. And once you've completed knee replacement and rehab, you can get back to those things. But what some of the authors have mentioned, and this is why I bring it up here, is that they said surgeons should be made aware of mental health issues in the preoperative setting. So sometimes I can pick up when someone's anxious or based on their medications tell that they're depressed. But I usually will ask those patients, what do they do to treat their anxiety? You know, are they seeing a therapist? Is the therapist aware that they're going to be having a knee replacement? And it's nice to have things in place prior to surgery to really minimize the risk of having any increase in symptoms after surgery. So a good question would be, how do I know if I am at risk of developing postoperative depression? Well, there's a few things that people have found in studies that show that you might be at a higher risk than normal to develop postoperative depression. Number one is whether or not you have preoperative depression. If you're already struggling with depression, you might be at a higher risk of having a postoperative depressive episode. The other issue is chronic or uncontrolled pain. A lot of patients before surgery have chronic pain, but after surgery, there are some patients that have difficult times getting their pain under control, and that can be a risk factor for developing depression. A lot of patients feel like they're a burden on their friends and on their family because they're going through this postoperative recovery period. And a lot of patients lose that sense of independence. They're reliant on other people, and it may make them feel depressed that they're having to have other people help them for pretty normal, mundane things that they used to do without any difficulty. And the other thing is financial worry. A lot of people, if they've been working or taking time off of work, and whether or not they have money in the bank saved up or if they're on disability, paying the bills at the end of the day can be a risk factor for developing postoperative depression. So you may be wondering, how common is postoperative depression? And again, remember that 8% of United States adults are diagnosed with depression each year. So I went searching for some studies to figure out what the statistics were. And one study showed that patients that have surgery for a hip fracture had an 18% rate of postoperative depression. Now, lower on the list was patients undergoing knee replacement, but a study showed that 10% of patients having a total knee replacement developed postoperative depression. And a little bit better than that was patients undergoing total hip replacement. That was almost 7% of patients that had postoperative depression. And again, postoperative depression is a real complication, something that we don't talk about very commonly, but the rate of postoperative depression is higher than a lot of the other complications that we talk about more commonly, things like blood clots, infections, blood transfusions, even hip dislocations and hip replacement. So it is a real risk, and it's important that you're aware of this if you're going to be undergoing surgery. When you're depressed, it's really easy to isolate, and many people suffer from distorted thoughts, like life is hopeless. It's important first, though, to admit that there's a problem, and that can be hard. It was difficult for me. The second thing is getting help. So talk to your friends and family members. Reach out to your primary care physician. They can help you. Luckily, we live in this world which is impermanent. Everything changes. No matter how bad things are right now, things will change, and things usually will get better. But it takes time. So they might refer you to a psychologist or a psychiatrist or prescribe medications. And all of those are helpful in treating depression. Unfortunately, all of them take time to become effective. Well, again, therapy and medication take time to work. So the following are things that I have used personally in my healing and things that I still use today that help me deal with my depression. So these are things that are completely under your control. First, number one, breathing. Breathing, as simple as it is extremely important, and it's portable. You take it everywhere you go. Many people that struggle with depression also struggle with anxiety. And most people having knee replacement struggle with pain, and this can help both. There's three things that I'd like to share with you as far as breathing techniques. The first is what's called box breathing. So you can try this and think of it as a box. You breathe in for a count of 4, you hold your breath for a count of 4, you breathe out for a count of 4, and you hold your breath for a count of 4. And you repeat that cycle as many times as you want. The second option is what's called 3-7-8 breathing. So this is where you breathe in for 3, you hold your breath for 7, and you have a slow exhale for 8. And you might be thinking, I can't remember all those numbers. It's too complicated. Great. 1 slow out breath. 1 slow out breath activates our parasympathetic nervous system. So you can breathe in and as slow as you can, breathe out. And you can do that as many times as you want and as many times throughout the day as you need to help settle you down when you're feeling anxious, when you're feeling pain. The second thing I want to talk to you about, which I strongly recommend because I have been practicing meditation for almost a decade now, is trying to meditate. You know, it might seem overwhelming or complicated, and it's really not. It is as simple as taking your seat, and after knee surgery, you can do this sitting in a chair, placing your attention on your breath, and just following your in-breath and your out-breath. And when thoughts arise, because they will, is just label them as thinking and return your attention back to the breath. You might find in a 5-minute session that you have 1,000 thoughts. That's okay. Each of those times that you recognize a thought and bring your attention back to your breath, it's like one mental push-up. And you might find it difficult to do it on your own, so you can check out a number of the apps that are online. So apps like Calm, Insight Timer, Breathe, Headspace, Healthy Minds. These are all apps that you can download and you can go through guided meditation. So something that I would recommend trying. The other thing, which is simple, get outside. It might be sitting on a porch, somehow just taking a walk, but getting outside has health benefits, especially when you're recovering and you sit inside the stuffy house. Get outside, see the sun, and get out and just get some of the fresh air. You'll feel better. The next thing is focusing on nutrition. It's very common after surgery for patients not to have an appetite, but it's extremely important to eat and to eat a healthy, balanced meal because you need the appropriate calories to heal your wound, to heal from surgery. So make sure that even if you're not hungry, what little food you eat is nutritious, especially high in fiber because constipation can be common after surgery. And it's important to have social contacts. When we have surgery and you're at home, it's very easy to isolate. And that makes you feel like nobody likes you and nobody cares and you're all alone and life is hopeless. But reach out because people are living their lives. And it's not that they think negatively. They might just be busy and you might not be able to meet up for your walking group or whatever other activities where you used to meet your friends. Invite them over. Have a Zoom call. Reach out to people on a daily basis and you'll reap the benefits of that social interaction. And the other thing that I would recommend is a gratitude journal. It's very easy to have a lot of negative thoughts. In the book, The Buddha's Brain, the author Hansen talks about how good thoughts slide off of our brain like Teflon and the negative thoughts stick like Velcro. So by making the effort of having a gratitude journal at the end of every day is writing down 3 things that you're grateful for. Remembering those good things can make you feel more positive about the day in general. The next thing I want to talk to you about specifically is what's called sleep hygiene. And this can be a topic by itself, but it's really important in patients after surgery that are dealing with depression because, again, you might have insomnia or you might not want to get out of bed at all. And sleep hygiene is extremely important. So I talk to my patients about it. So number 1 is set a sleep schedule. Wake up time, go to bed time. Make sure that you wake up at the same time every morning, set an alarm, and make sure that your bedtime is consistent, that you get upstairs and go to bed or get into bed at the same time each night. The other thing is no screen time. So none of this, phones, tablets, computers, TVs for 2 hours before bedtime. That can distort your circadian rhythm and your body and brain then do not want to fall asleep. The other thing is only use your bed for sleep. It's very easy when you're recovery to lay in bed. I even tell my patients, like especially the women, say, I'll tell their husbands, hey, look, it's not Mother's Day or their kids. It's not Mother's Day. They don't get breakfast in bed. You get up and you eat the meals, breakfast, lunch, and dinner at the kitchen table like a normal person. But if you need to lay around and elevate and ice, make it on the sofa. Do not make it in your bed. The bed is for sleeping. And the other important thing is limiting naps. It's very common if our sleep schedule gets disrupted that you're tired in the middle of the day. You've just worked out with therapy, you're tired. It's not uncommon to need to take a nap, but limit the nap to 30 minutes. Set an alarm or have somebody wake you up so it doesn't distort your sleep cycle, because a distorted sleep cycle is only going to worsen the symptoms of depression. So in closing, I want to bring up the idea of action before motivation. It's very easy when we're depressed to lose the ability to do simple tasks like cooking and cleaning and getting out of bed and having conversations with our social contacts. We isolate and we limit our activities throughout the day. It only worsens our depression. So if you're scared to do something, do it scared. If you don't want to do something, do it anyway. But if you get up and get out of bed and set a list of things, as small as they might be, that you want to accomplish each day, you're going to find that it builds momentum and that it's going to allow you to get out of the funk, get out of the depression, allow you to complete more tasks the following day, and that is your road to recovery. I've been there. I understand what you're going through. It's not easy. There are still good days and bad days, but doing nothing is not going to help, and doing something is the path to getting better. So again, until next time, I'm Adam Rosen. Thanks for watching, and I'll see you next time.